During my consultation, when I was first diagnosed with prostate cancer, and we sat down with Dr. Brito, my wife and I, he gave me a couple options. First one was the surgery, the prostatectomy with the robotic, Da Vinci robotic surgery. That was an option. Or the old school manual surgery where they actually go in there and they cut you below your belly button. That was another option. He also gave me an option of doing the beads, the implants. The other ones I didn't qualify for because I was so young to have prostate cancer. It was deemed aggressive. And so he thought that the best treatment for me would be a full prostatectomy. So what he explained to me with the Da Vinci is that they would come in with 8 incisions. It's almost like if you had a scope done on your knee, little small pinpricks. He would be in the corner of the operating room underneath, almost like some type of machine, and he would control the robot. It's kind of awkward. I think I'm upside down. There's a certain way that you're tilted when they do this surgery. And so once again, they came in, 8 incisions across my stomach, and actually I don't know if you can see them, but I have a little incision here, one there, and you can see them come across my stomach. Using the robotic surgery, he assured me that that was one of the best ways he could preserve my nerves. Because if the doctor doesn't do a good job, then you'll lose some function. The surgery was supposed to be 2.5 hours and actually ended up being 1.5 hours, which was awesome. Recovery time wasn't too bad. I was in the hospital for 1.5 days, probably about 3 or 4 hours after my surgery. I started to walk. I mean, they give you morphine, they give you all that stuff, and I was like, I don't need that. Just give me a Tylenol and let me get to walking in the hospital. And so I would walk my rounds trying to break up the gas. And on top of that, I had a catheter, and that was probably the most painful of it all was that catheter. Surgery was fine, but that catheter for 10 days after surgery was probably one of the toughest things I had to do.
On this field, a single decision can change a game. For a man with prostate cancer, a single decision can change his entire life. While I chose surgery, a less aggressive approach called active surveillance might be the best choice for you. Ask your doctor about a genomic test that may help you make the right decision. Learn more at yourprostateyourdecision.com.